Dry mouth is common problem. It affects around 10% of world population. It's much more common among older adults and affects around 25% of older population. And if we don't know anything about patient and patient come to us and he or she says that has dry mouth, we think about dehydration first. Dehydration is the most common cause of dry mouth and is responsible on 30% of cases. And what causes dehydration? Loss of fluid or inadequate intake of fluid, especially water, exercise, illnesses such as vomiting or diarrhea, or hot environment and excessive sweating also. And there is general recommendation that adult requires 2 or 2.5 liters fluid intake per day. It can be higher for males and lower for females and depend of course body weight and body mass, but generally we should think about 2 to 2.5 liters. Second most common cause is medications. We should think about medications also, especially antihistamines. Antihistamines especially for kids and for adults of course, but in case of kids antihistamines are more common. Antihypertensives in adults of course, and antidepressants. So and many other different medications can cause dry mouth as a side effect, but most commonly used ones are antihistamines, antihypertensives, and antidepressants. And medication side effects is responsible on 25% of cases of dry mouth. Another common problem is mouth breathing, and it's more common among children, and it's responsible around 20% of cases of dry mouth. You can see classical face of mouth breather kid, and mouth breathing is caused by structural problems or nasal congestion. If it's chronic, it's usually structural problems. And why important mouth breathing? Because it causes not only dry mouth, but also in future it's associated with heart problems, cognitive problems, sleeping problems, halitosis, and dental problems. That's why mouth breathing requires treatment to prevent long-term complications. Another common cause is tobacco or alcohol usage, and mechanism is simple. They constrict blood vessels, and less blood to our glands means less saliva production, and it causes dry mouth. Another important cause is diabetes. Diabetes also causes dry mouth. And what is classical symptoms of diabetes? Frequent urination, increased thirst, unexplained weight loss, dry mouth, and blurred vision. It can occur among kids and adults also, but in kids it's rare, and it's type 1 diabetes among kids, and it's responsible around 5% of dry mouth cases. And among adults it's much more common, and it affects around 10% of dry mouth people, especially who has chronic dry mouth, not acute and not only short term. So we should think about diabetes also, especially if there is symptoms such as frequent urination, increased thirst, unexplained weight loss, and blurred vision. And it's easy to diagnose because we can measure blood glucose level and insulin level also. Now let's say about much more rare disease. It's Sjögren syndrome. Sjögren syndrome is responsible on dry mouth around 5% or less, and it's autoimmune disorder attacking moisture producing glands. So our body mistakenly attacks our cells, attacks our tissues. That's the idea of autoimmune disorder, and it's Sjögren syndrome, and it causes dry eyes, dry mouth, possible coughing also. And how we can diagnose: we measure antibodies in our blood, such as SSA and SSB antibodies. It's ANA antibodies, and such autoimmune disorders also conjugated with other autoimmune disorders such as rheumatoid arthritis or lupus erythematosus, and it's more common among women and over the age of 40. That's all I wanted to say. If we say, to summarize, if we say dry mouth, first we think about dehydration, medications, and mouth breathing. That three is most common. Of course, tobacco usage, diabetes, and we should exclude also Sjögren syndrome. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.